My name is Michaela, and I wanted to bring you through the journey of triple negative breast cancer when you are under 30. So I'm glad you found this video. I'm not sure how you found this video, but I'm glad you did. And I'm really excited to kind of talk about the things that I've been through. Hopefully those will be things that will help you.
You love watermelon. Huh. Yeah. We love it.
So first I want to say thank you for finding this video and thank you for tuning in. So if this is the first day that you found out you have triple negative breast cancer, or if this is your last chemo session, or maybe you've dealt with cancer a few years ago, I just wanted to tell you and remind you to just take a deep breath, because you now have an entire support system. You know, I really felt like I didn't have people that understood what I was going through, even though there are so many family members and friends that, you know, when they find out, they'll say, oh my gosh, like, I'm so sorry to hear, I don't know how to help you, but, you know, please let me know what I can do. And that is so kind and so nice. But there's really not a lot other people can do sometimes. Sometimes we just have to sit with hearing it and with understanding it. And when we're very first told you have cancer, it doesn't matter if it's stage 1 or stage 4, it's life shattering. I mean, honestly, like it should wake you up. So again, I hope you can take a really big deep breath, and then I hope you can find yourself a really great support system of people who have been through this. So for me, I went to Instagram to find some people that might have been through it, and there was a lot of information on there, and sometimes that can be overwhelming. But part of the reason that I'm making this YouTube video is because I really didn't find anything about triple negative breast cancer for women under 30. So I was diagnosed in February of 2019, and I was 29 years old. So I was on, you know, the far end of the 20s. But you know, it definitely changed a lot of things for me. You know, prior to getting that diagnosis, I just felt really, really tired. I had really felt like all this work that I had put in for losing weight was just, you know, not sticking, and I wasn't gaining a ton of weight, but I mean a little bit back, and it was just really defeating. So I know that at the time it made sense. Oh, okay, that makes sense why I was feeling so tired and just like, I mean, exhausted. Not even tired, just exhausted. And it really made a lot of sense. I've always had cysts in my breasts. I've always had, you know, kind of one breast larger than the other, but I had had a tumor in my left breast that was about the size of a golf ball. So it was pretty big. But the thing is, I've had other cysts that were that big before. So, you know, looking back, it all makes sense. And it was definitely something I probably should have gone to the doctor for sooner. But, you know, when you have cysts every day since you're 12, 13, I mean, you know, going to the doctor for a different one just seems like it might be, you know, something that you don't need to do. It's not that big of a deal. But now I go, if I have, you know, anything new that comes up, I definitely go, and, you know, I kind of monitor it myself a little bit to see, like, okay, is it squishy? Is it hard? So, so that's just something that I feel very strongly about now, is to make sure that I am making sure that I am really putting myself first. So early February, it was the 4th of February 2019, I was diagnosed. The doctor called me on the phone and said, unfortunately, actually it was her nurse, she said, unfortunately, we did get the results back of your biopsy and it is stage 3 triple negative, which, it wasn't something that I could really find a lot of words for. It was just kind of like, in my brain kind of always works as, okay, what do I need to do next? Like, so you've given me this news, what do I need to do with it? So, so I had a pen and paper right there, and we had scheduled, I believe, 4 appointments for the following week. So I had, so the following week I went in for a breast MRI. I went in for genetic testing to see if I had the BRCA genes and then like 20 other genes. I also went in to talk with the doctor, the breast surgeon, about if, I had any questions or anything like that. And then I had one more appointment. What was it for? I think they were all on the same day or around the same day. So, but I had one more appointment, and it might have been a brain scan or a bone scan. I don't really totally remember, but yeah, so there's, 4 or 5 appointments that you're probably going to have immediately. So because I was 29 at the time, the doctor really encouraged me to save eggs. So something that I just haven't made the decision about yet is if I want to have children. My husband and I, we just celebrated our 10-year anniversary this May, and we just haven't totally decided if we want children yet. Maybe someday, and that would be really awesome, but maybe not, and that'd be great too. So we decided to freeze embryos. So we have 3 babies in the freezer, as we like to say. And at the time, I thought, why am I doing this? Like, I don't even really want to have kids. If I have a dog right now who is tearing things up because I'm not paying attention to him. I don't need any children. But, hindsight, I'm glad that I made the choice. My husband said, I really don't care what you do if it's your body, basically. So freezing eggs, that was, embryos, that was, a ton of work. If you don't know about the IVF kind of process, for me, I had been on birth control for a long time since I was a teenager. I've never been off birth control, and so of course I stopped birth control, and then I had maybe 2 weeks or so to basically be forced to ovulate, and so when we went through that process, I was a little disheartened. Oh my gosh, like, I'm young, and hold on, let me throw this frisbee. See if he gets it. Did he get it? Woo, did you get it? Good boy. I was a little disheartened that, we were only able to freeze 3 eggs, because I thought, oh my gosh, I'm really young. How can I only get 3 eggs out of this whole deal? But my husband really, he's been great through this whole thing. He really brought to light this idea that, okay, Michaela, you were on birth control for a really long time. All of a sudden, you're off of birth control, and you're basically trying to freeze eggs. So the fact that you got 3 is a pretty big deal. We were not trying to have kids. We were not trying to, this hadn't been months long of you know, being off of birth control. This was literally like a matter of weeks. So that made me feel a little bit better, even though I wasn't sure if I wanted to have children. You know, it's kind of that mentality of like, oh my gosh, like I'm a loser. I can only get 3 eggs. No. So yeah, so that was my experience with the egg process. So, the process of going in and retrieving eggs, so you have to give yourself shots. If you can't do it, you might ask, there's a lot of pollen outside and it keeps falling on me. You might ask your spouse, or you might ask your sister or your friend. There's usually somebody that's probably going to be willing to stick you with a needle. My spouse is not. He hates needles, so I had to do it all on my own, but that's okay. It didn't really bother me too much. The first time was really scary. I'll be totally honest. The first time, I wasn't sure if I could do it. I just had to literally count down 3, 2, 1, and do it. And then after that, it was, you know, like riding a bike. We went to the fertility doctor the first time to talk about what the process would be like. We went to the fertility doctor the second time to do blood work and to get the first round of medications. We went to the fertility doctor like 2 more times, I believe, to kind of see like how my eggs were doing, if they could see any in there. And then I believe it was the 5th time we went, I was given what is called like an activation shot, where they, it's a bigger needle, but it is, it's basically to force your body to start releasing your eggs. Once the eggs were released, the shot basically tells your body, okay, you are now going to release eggs at this time. And then my appointment was set for a specific time for me to go in, be put under, for my husband to give his sperm sample, and then I believe they probably do the addition of the egg to the sperm to create the embryos that day, probably. But yeah, so it was a procedure. They put me under. Some women choose not to be put under. I was totally fine with being put under. So you know, they give you a gown and you just go, and it feels like a quick process, but I think you're probably in there for like 20-30 minutes. But it's scary to not know. But I think that the biggest thing for me was that I didn't feel hardly any pain. I didn't really feel like I was a burden on anybody. Like I just really went in there and I felt supported, and I felt like the doctor and the anesthesiologist and the nurses, like they were really sweet and really kind. I have no idea what I said under anesthesia. Probably crazy stuff, but I remember kind of coming to and asking the nurse about where the closest restaurant was, because apparently I was hungry. So I don't know if maybe that's what I was talking about the whole time or what. So after egg retrieval is done, there were plenty more appointments. So I had to get a port put in, which you can kind of see the scar here. I still have the port in. It's right here. And when I do that, you can kind of see how that raises a little bit right there. So the port is this little plastic piece that it's about maybe 1 inch by 1 inch, and it has a little rubber hole kind of a thing, and it's where you will get chemo from. You don't have to get a port. I chose to get a port because I felt that instead of getting stuck with the needle every time I went, I would rather have You know, I mean, I am still stuck with a needle, but it's not in my veins. It's just somewhere where, you know, hopefully won't, you know, blow a vein or something like that. Not that I've ever had that issue, but it was just, it just felt like the right thing to do for me. But it's everybody's choice of what they want to do. The port surgery did not hurt at all. It was a surgery that I was awake for totally and completely. It didn't hurt at the time. It hurt a little bit the next day, but it really felt more like maybe like a bruise more than actually like an invasive surgery, because it was. Port surgery happened and I received chemo about a week later, a week and a few days later. So during the port surgery, or well after, they give you a prescription for a cream that you can put on the port to kind of freeze it a little bit. It makes it really cold, but it just kind of numbs your skin. That way when you are receiving chemo, you don't feel the needle go in. Some people can feel the needle every time they do chemo. Some people, it doesn't hurt them. Other people need the cream and the spray that they have. It's like a freezing, numbing spray. And I was, you know, the first time I was so scared. I really just didn't know what to expect. And I'll talk about that in a minute. But so I, of course, picked up the cream. And they come in little tiny tubes. So I kept one in like a bag that I brought with me to chemo every week, and then I kept one in my car, and I kept some in the house. It just seemed like, you know, as long as I had it somewhere, I was happy to have it. If I didn't need it, that was fine, but you know, when you're scared, you just sometimes don't know the right thing. So that felt like the right thing for me, was to put it in every place that I could possibly be so that I wouldn't forget. And how the EMLA cream is what it was called, but how the cream is applied. So you just put a little bit, like maybe like a tablespoon. No, way less than that. No, maybe like the size of like a dime, like this much, that much, very, very small amount. You just put it on there and you kind of make it like really thick on there. And then you take a piece of like saran wrap and you just put it over there, and then just put your shirt over it, and it should stick right to the cream, and then your shirt will basically just kind of lay on top. And you would do that about an hour before you go to chemo, within an hour before you're going to go. And that way it'll be nice and numbed up. So I've been talking a lot about all these appointments that I had to go to. I kept all of the wristbands from all of these appointments. It just seemed like there were so many. At one point I counted how many wristbands I had from the first month of finding out that I had cancer, and I believe I had like 22 wristbands. That's not all the appointments. So some places I had appointments 2 or 3 at the same place. There's a lot of appointments. And luckily for me, I still have this job, but I have a job that is very, very, very flexible. Is for me to be going through this stuff. It's not a flexible job in general, but they were very flexible with me, and I was so, so grateful, because I mean, you know, I can't afford to not get paid. You know, I really couldn't afford to take a bunch of time off, because I knew I would eventually have a surgery that I needed to save up leave for. You know, so it was a lot. It was a lot, but you know, so I was just very grateful to have that opportunity to be able to telework and to be able to, you know, really kind of flex some hours and do the things that I needed to do so that I would still be able to get paid a 40-hour work week. Everybody doesn't have that option though, and I realize that. my hospital has this program, forget what it was called, Angel program, St. Agatha program, that's it. If you have to make a certain amount of money, but so I unfortunately didn't qualify, but most people probably do. And it is, if you make under a certain amount of money, you can qualify for this program. And I believe they help pay some of your living expenses while you are completing treatment. So I know somebody that I talked to while I was going through treatment, and she had said that she qualified and they paid for her electric. They paid for, what else did she say? I think she said they helped pay for some of her gas bills and things like that, gift cards for, going to get gas to get to her appointments, those kinds of things. Which is amazing. I mean, that's something that I hope when, I'm done with everything that I can actually give to, because, what a blessing, to be able to help people that were in my situation, But anyways, so, yeah, so, I would really encourage you to reach out to programs that, that offer that kind of a thing. If your hospital or oncology center has a program that can help you, I would definitely look into it, because some help is better than none. So, okay, so the first day of chemo, I was pretty nervous. I really felt just so lost. I didn't know what to expect. I had what they call chemo care. It's this program that a nurse walks you through what to expect, but it's different to hear what chemo is like from somebody that's never been through it. So for myself, like I said, I didn't find very much information about what to expect with chemo. I hadn't really seen anything, and believe me when I tell you, I'm a researcher, okay? You give me a topic, I'm gonna go and research the hell out of it because I want to know. I joke all the time that I go down these rabbit holes of this is interesting, let me find out all this information. And I'm telling you, there's just not enough. There's not enough women who were young with triple negative going through the stages of what to expect. So I was scared. And maybe even having the information, I still would have been scared. I don't know. But this was my experience. So I'll just tell you about that, and you can take away what you want to take away. So the first day of chemo, I started every day of chemotherapy at 12 o'clock. So my regimen was 4 rounds of AC, which I will write out the whole name, acetromycin something. Okay. And then I had 12 rounds of Taxol. So I had 4 rounds of AC first, and then 12 rounds of Taxol. The 4 rounds of AC were every other week. The 12 rounds of Taxol were every week. So I chose to do my chemo on Fridays. So the first day of chemo, I chose to start chemo every day at 12 o'clock. And basically how it works is, at least at the place that I went to, they said, okay, this is the first day of chemo, what time would you like to start? So they did give me a little bit of leeway, with the times, and they basically said okay, well, you can start on a Thursday or Friday, what do you want? So I chose Friday because I really wasn't sure how my body was going to react. I didn't know, from all the research that I had read, everybody's so tired during chemo, and it's something that is, totally debilitating. And again, I had to work. So my thought was, okay, well, if I can just do this on a Friday, I have Saturday, Sunday off, I can relax on those days. So that was what I chose for my day. And I went in at 12 o'clock, so I live about an hour away from the facility because I live out in the country, if you can't tell. and so I would log off my computer every day around 11, and then at 12 o'clock I would be starting my chemo. It was really more like 12:15 after they kind of got everything set up, and then I would actually work from the location because we had Wi-Fi, which was amazing. So the first day of chemo, I said I was really scared. I really just didn't know what to expect. So I'm hoping that I can kind of describe it a little bit, and then I will post some pictures, and if I can find a video of that I had taken, I'll post that. So the first thing for me that I had to do was I went into the facility, and they take sometimes they have to take blood and sometimes they don't, just kind of depending on the appointment. The first one, though, I don't believe they took blood. I believe they'd taken it at an appointment that was a few days prior. They are looking at your white blood cell count. They are looking to just make sure that your numbers are going to be able to sustain you through at least that chemotherapy appointment. For me, I went into it, other than the cancer, relatively healthy, so my counts were great. I was able to complete chemo for the first time, and then I was able to actually complete all of my chemos without any issues at all. But as far as my white blood cell counts, that first time, they were pretty high. But then during the first couple of appointments with AC, they gave me this patch kind of thing that has like a box. So it's like think of like a Band-Aid, like a big Band-Aid, and it has a box maybe about the size of like 1.5 inches by like 1.5 inches, and it's called Neulasta, and it sticks to the back of your arm, or I think they could also put it on your stomach, but I'm gonna get it on my arm. And it has this little like weird kind of needle in it, but it's like a plastic piece. And anyways, it kind of helps with your white blood cell counts while you're going through chemo. I had that a couple of times in the beginning, and then I didn't have it after that. So hopefully if you get something like that, it won't become a surprise to you. It is something that I think, sorry, there was a bug on my on my camera. If you get some kind of a Neulasta or whatever medication they have at that time, hopefully that will help you to be able to complete all of your chemotherapies as well. So the first appointment, again, going in around noon, getting blood work done if needed, and then the nurse would call me, ask for my last name and my date of birth, and I would give that information as needed, to whoever needed it. Usually it was like so they would ask me for my last name and my date of birth, and then I would walk back with my bag and my husband and my tea that I had just poured myself, and usually they would already have a station set up for me. The place that I went to was kind of a larger area, but if your place is small, you might have more of a choice. There were a couple of times that I wanted to sort of be in the corner or like by a window. Usually they could accommodate me, but at the place that I went to was pretty large, and they had it didn't feel like I was a burden, or that I was being looked at or anything like that. There was kind of like divider walls, which I liked, but because it was so large, there were a lot of nurses that would be there, and so they kind of all had sections. So so I walked back and I was sit down. The nurse that I had, she was so sweet. I really liked her a lot. And it was just kind of one of these things that she was the first nurse I had that gave chemo. And then after that, I was just like, oh my gosh, like I hope I have her every time. So I'm sure that, you know, had I had another nurse, I probably would have felt that way about her too. But there's just something that, you know, that you just place a lot of trust in somebody, and you know, they're telling you about the medications. And, you know, they're there for that very first time that you have to go through it. So, you know, it's just a bond, as silly as that sounds. But, it's just so interesting to like think back. It's been, you know, a little over a year. Today is June 12th. So, I started on May 1st. I started chemo on May 1st. And, you know, no, I'm sorry. I started chemo on March 1st, not May 1st. But, you know, so it was just like seeing that person for 4 months. You know, even though I sometimes had a different nurse, I always really liked when I had her, because she, you know, she was just that like kind of first person to be there and walk through that with me. So but anyways, so the first time it's scary because you don't know what to expect. And it's scary because you don't know how you're going to feel. You know, you think, you know, you of course read about chemotherapy. And you think, am I going to lose my hair? You know, after this very first treatment? Am I going to, you know, become so ill that I can't be with my family? But I hope that that's not the case for you. I know for myself, I was just scared that I wouldn't be myself. So, and I would say that without a doubt, cancer changes everything. Excuse me. Anyway, so, you know, if I can say anything about that first treatment, it is scary because you just don't know. So I hope that you get a nurse that is really lovely and walks you through all the steps like she did with me. So the first thing that they do is, like I was telling you about that cream, you know, you take off that plastic wrap, and then they spray. If you want, they'll spray you, which I said, yes, definitely spray me. You know, I didn't want it to hurt. I don't know what, you know, it's gonna feel like. So they sprayed, and then so she came by with a cart that I had to basically sign to say that I wasn't pregnant, because some chemotherapy can really harm a baby if you're pregnant, and so of course they don't want to do that. So I signed a form saying that, and then she brought out the cart for me to start with my chemo. So they go back to the to the pharmacist, and they bring back your medications, and the medications that are distributed are specific to you. So they have a nurse come who verifies, okay, medication, you show them your wristband, they look at the medication on the vial, they look at your wristband, and then or the bag, whatever, you know, whatever it is. Some of them are vials, some of them are bags. And then you know, they just kind of do that like two-person type of verification. So that's kind of nice to know that hopefully, you know, there won't be any mistakes. So you're first set up with saline. So if you don't know what saline is, it kind of just helps to hydrate your body, hydrates your, you know, your artery that your port might be in, or your veins, you know, wherever they're going to kind of put the chemo in. And it also helps, you know, so that you don't get too sick, because if you're dehydrated, that's how you can become sick. And so then after the saline, they usually put in Benadryl. No, I'm sorry. No. After the saline, they usually will put in a couple of different medications. Sometimes they'll kind of start with a medication that, for me, made my vagina feel like I just pissed myself. And then it also gave me this weird, like, tingly feeling at the top of my head. I'll link the name of it below. I wrote it down. Doxycycline, I believe, is what it's called. But I'll write the name below. And I asked, well, the nurse, she's so sweet, she said, I will push this very slow. Excuse me. And I said, okay. And so she was kind of talking me through it, and I said, oh my gosh, like, what is that? And she said, where do you feel that? And I told her, and she said, oh, okay. She said, in the future, she said, tell all of your nurses that you want this specific medication pushed slowly, because it will help to kind of alleviate some of that. Because some nurses just kind of push it quickly without really thinking too much about it, because for some people it's okay. But for others, it needs to be pushed a little bit slower. So, so then next up was the actual chemotherapy. So AC is red. You might see some things, it's called the Red Devil, because it's super, super potent. And the biggest part about it is that there's two things. Number one, the Red Devil is part of the reason that you lose your hair so quickly. So because it is so aggressive, it is a medication that causes a lot of people who receive this medication to lose their hair very, very fast. They might not lose all their hair, they might only lose hair in some areas. Some, like a very tiny amount of women or men do not lose their hair at all. But yeah, so, and typically hair loss won't start until the second treatment. Sometimes it does start before then. Sometimes it starts a couple of treatments later, but typically most people will see hair loss and things related to hair loss that second, like kind of that second week of the second treatment. So the first treatment, I didn't lose any hair, but I had cut my hair. That was really important to me, was to cut my hair before starting chemo. I will post a picture of how long my hair was before. It was so long. And so yeah, so it was just really important for me to do that. It was also really important for me to get a wig before I started chemo. It was something that I really just didn't want people to know. I didn't want people to feel bad for me. I didn't want people to ask me questions that I just didn't want to answer. people are so evasive, I mean, even people that are, gonna say, oh my gosh, I can't believe you're going through this. Imagine somebody who you don't know. That was kind of what went through my brain anyway. So, yeah, so, anyway, so AC is a medication that will rapidly cause the hair loss. There's probably other ones that do too, but for me, this is the one that made me do that. So the first appointment, so they put in the doxycycline or whatever, and then the chemo medications came. And all of this is put in through the saline bag. So you're hooked up through chemo, so you have this port. A lot of times they'll kind of just tape like a, I don't really know what it's called, but basically like the line, they'll tape it to your shirt. So wherever you're sitting, they'll kind of figure it out, and then they'll sort of just tape it so that way it's not in your way. And then most of the stuff is really just pushed through the saline bag. So you have a saline bag hanging. You'll have this box that just tells all the numbers of the saline and how quickly it's going through you, and how long. Basically, there's a timer, and you'll kind of hear a lot of beeps. I'll try to insert a video that I think I have still of that sound, so that way you can kind of understand what you're going to be hearing. And so for me, the AC went through my system really quickly because of that saline that they had at first. And so I always had to use the bathroom around like 1 o'clock-ish, 1:15-ish. It was just something about it. Always had to go. So I would have to bring, I don't know what it's called, but that metal thing that the saline hangs from. I would have to literally bring that with me because I'm still hooked up. Go into the bathroom, and it's a pretty long line as far as from the port to the saline bag. It's pretty long. So, I'd wheel that to the bathroom, go potty, and then I would, come back out, and then there was a second part of the chemo, I believe, that was given after that, and then I would get Benadryl. So the part about AC that they didn't really tell me was that my urine would be red. So it's red in the tube when they put it into the saline, or into actually that one I believe they just push right through the line, yeah, so it's red in the tube, and then when you use the bathroom less than an hour later, it is red in your urine. So that's really quite interesting. So after I would go back and sit down, then I was usually given, I believe, the second part of the chemo, which I'm not a medical doctor. I don't know all of the names for everything, so I will kind of list what it is below, but I would get that medication, and then I was usually given Benadryl. So Benadryl makes me very, very tired when I take it in pill form. When I get Benadryl as an IV, it makes me very loopy, which I told them. So for me, I had to make sure that I always had a driver with me because it just would make me kind of silly, and my whole body just sort of felt like, if you've ever taken pre-workout, that's kind of what my body felt like. This kind of prickly, almost like psychedelic type of feeling. One time I got really, really tired with it, but for the most part, I usually would just feel loopy or like prickly. So that was my experience with my very first chemo ever while I was there. I do want to just mention that Something that I wasn't sure that I wanted was to get a wig. And I'm so glad that I got one. I actually ended up with 3 wigs. So I purchased a wig from a wig shop, and it wasn't real hair. It was, I forget what they call it now, but it wasn't real hair, and it was over $400. It was really expensive. To me, that's expensive. But it looked really nice. I mean, honestly, it looked just like my hair, just like a little bit longer. You know, kind of when I had my haircut to about here a few days before chemo, and then my wig was probably like here. Looked really nice. You know, I wore it all the time. My mother purchased me a wig. She found it online, and it was real human hair. And I tell you what, that wig looked, you could not tell that it was not my hair. And honestly, the wig that I had before that wasn't real hair, really was hard to tell that it wasn't my real hair. You know, so I would really, really, really encourage people to get the wig. Even if it's kind of expensive, just get it. My insurance would pay, I think, $400 of it. So for me, it was like, you know, that was like right around my budget that I was going to, you know, buy a wig for anyway. Some people, you know, you got to check with your insurance, because I'm not really sure what, you know, what all the coverage is, but yeah, so you might, you know, just at least go into a wig shop and understand like what might look good on you. You know, you could go totally crazy and get something really fun, or you could get something that matches what you have, or, you know, you could get a wig that's different, but, you know, still looks real. I mean, whatever, you know, whatever your heart desires, do it. For me, I wanted one that looked, you know, like my natural hair. But, you know, they have lots of fun wigs out there. I mean, you could get a color, you know, like pink or green or whatever. You know, you can get super short wigs, super long wigs. You can get, which I never got one of these, but I kind of thought about getting one. It's like this piece of like a headband kind of thing, and then it has like bangs on it, so you could just wear like a big, huge hat if you live in an area that, you know, or really anywhere, but, you know, if you like to wear big hats like that, or if, you know, they had like some turban kind of looking pieces that had like a little bit of bangs, so it just sort of looks like you have your hair kind of up. So there's lots of really cool options. So I would really encourage you to do that before you start chemo. So after I got Benadryl, I had to sit for like an hour to make sure that I didn't have a reaction to the chemo. So, like I said, the nurse that I had was so great. She, you know, kind of sat with me for a little bit, and she would just kind of check in. How are you feeling? What are you feeling? Tell me about what's going on for you inside of your body. So that was really nice. And if she doesn't do that, I would really, if your nurse doesn't do that, I would really just encourage you to kind of write down what is going on. And if you feel like you're having some kind of an adverse reaction, definitely reach out. Of all of the things that I have learned through cancer, you are your biggest advocate. Let me say that again. You are your biggest advocate. I was relatively healthy before cancer. Went to the doctor once a year, maybe, if I just like needed something, or I have asthma, but it wasn't like so debilitating that I couldn't function. It was just kind of like, you know, when allergies are up, or when, you know, if I was like running a lot, or if it got like super, super cold, you know, I would get asthma inhaler prescriptions for like a year out, and sometimes that would last me a little bit longer, like just depending on, you know, how things were. So I rarely went to the doctor. You know, so for me, I never had to advocate for myself like I did with, you know, in the last year for things. So I would just really encourage you to always have something to write with, a little notebook, a pen, and then that way, if you are kind of feeling some kind of something in your body, just really listen, really hone in, and write it down. And then, you know, the next time the nurse comes by, say, hey, is this normal? I'm experiencing this, and I just want to know, you know, if this is something, like, does everybody feel this way that tells you? So after my first full treatment, they put the Neulasta on. So it's about, you know, like 30-ish minutes, 40-ish minutes after the Benadryl is given. I'm feeling loopy. They say, give me your arm, I'm going to put this on. I say, okay, great, no problem. So they, you know, put this on, and like I said, it feels like a Band-Aid. It's a little bit bigger. I mean, probably total, that sticky part, the adhesive, is about maybe like 3 inches or so, and then by like 2 inches maybe, it goes on the back of your arm, and then and they set it to basically go off like a certain number of hours after you've been given your treatment. So I usually walked out of treatment around 4 o'clock-ish, 3:30, 4 o'clock-ish. And so I would, so I want to say it's 27 hours, because it was always like that next day around like 6-ish, 7-ish o'clock at night that you would hear this like snap of a rubber band, and that's what it feels like. It doesn't hurt. But you'd kind of like hear this like snap, and then you'd know that it's gonna kind of go off. And the nice thing, at least, about this technology is that there's, at least the one that I had, there's this little screen, and I believe it would say full. And then once it would snap, it would like kind of blink, and then it would, when it was done, it would say empty. So that's how you knew to take it off, and you can take it off yourself. I never I never really hit my arm or anything, and if I did, it didn't hurt, but it was just kind of like, oh, like, that kind of hurt, you know, like, but not really, you know what I mean? Does that make sense? It hurt, but it didn't hurt. It was kind of like hitting like a bruise sort of thing. But anyways, yeah, so I would just say, if you're gonna take it off yourself, like, do like a 1, 2, 3 pull, or have somebody that you know and love and trust to pull that off for you, because you don't want to break off that little piece of plastic that's in there. I mean, I'm sure if you did, you could probably pull it out or whatever, but they kind of just told me, like, pull it quick, pull it fast, all in one motion. So I took that to heart. So immediately after chemo, I said, well, you know, I can still eat. So, you know, I told my husband I would like to go eat. So we did. So we went to Five Guys. I ate a burger, fries, and a shake. I just didn't really feel any different. Like I said, I was feeling a little loopy from the Benadryl. It's a pretty quick acting thing, so it was kind of more like those like 30-40 minutes after I had it, I was like, ooh, okay. But then once we got in the car and, you know, we're driving, I was fine. So we went to this place. I think kind of everywhere has it, but it's called Five Guys, and they like make their own burgers and their own fries and stuff, and it's really good. It's delicious. So if you ever get a chance, you should go. And great food, loved it. It was kind of a nice thing for my husband and I to sort of decompress a little bit, you know, just because we both really didn't know what to expect. When we got back that night, I don't really think I did much. I mean, I was tired, but it was just kind of like, you know, the normal tired that I had felt, especially in the last month of finding out that I had cancer and giving eggs and, you know, 100 appointments and, you know, all the things. So, you know, but it was just kind of, you know, it just wasn't that different. It was just a normal tired. I didn't feel different. I didn't feel like, you know, exhausted, like nothing like that. So, You know, I don't really remember what we did. I think we just kind of hung out and probably watched a movie. I honestly probably laid in my bed. um, and then, uh, and then I do remember not sleeping. So that was something that I would not have expected from chemotherapy was the first weekend, and this was the trend for me. This was my experience. I really didn't sleep. So I had chemo on Friday, hardly slept Friday night into Saturday, Saturday night into Sunday, Sunday night into Monday. Monday night I would crash. So I worked Monday through Friday. A lot of times I had Wednesdays off. It's just the way that my schedule worked out. But I started work at 5 a.m. So for me, it was really hard to wake up to be to work at 5 a.m. So again, my work was so generous. They would allow me to telework those days. So I did, because there were times where, you know, I was rolling out of bed at 4:55 to get to work at 5 on my computer, 25 steps away. So, yeah, so for me, you know, Saturdays I would just kind of be up, and it was sort of like, I don't know if it was just because I was so tired or if I had had a bunch of steroids. Couldn't tell you, but I do know that I really didn't slow down personally. For a lot of people, you know, chemo can make them very tired and all that stuff, and it did eventually, right? Like I said, on Mondays, but Saturday and Sunday, I usually got a lot more done those days than I did any other day of the week. So I would usually clean my whole house, meal prep for the week, go see friends, watch some movies, go out and do stuff. One time after chemo, we went to, what are those called? Oh my gosh, they're so much fun. A drag show. Super fun. Loved it. I went the night that I had chemo, you know, like it didn't make me feel like I, you know, was so tired that I couldn't function. So after the first time of, you know, ever doing chemo, I would have to say that every other time after that got a little bit less anxiety provoking. So if you're like me and you enjoy having control, you enjoy being the person that is making the decisions, that doesn't really ever go away, unfortunately. Especially with cancer, you always have a choice, but you have to make the choice that's best for you. And there's a lot to take in, you know, there's a lot to consider. I think in a perfect world, we would all, you know, make a choice that is going to be, you know, the best choice. And unfortunately, it's not a perfect world. So you have to decide in the moment of what that best choice is for you. For me, my choice was to complete chemotherapy. I felt like I'm not even 30 and I have to go through cancer treatment for my breast, right? Something that, you know, our mothers go through, something that our grandmothers go through, or our great aunt, or, you know, not at 29, right? So, you know, and I think sometimes until we're in that moment, we really just can't make the decision of, you know, we can speculate. We can say, oh my gosh, if I was 29 and I had cancer, I would do this. Or if I was, you know, blah, blah. If I was 70 and I had cancer, I would do this. But until you are in that moment, you just don't know. So be kind to yourself. Make the best choice for you. Talk with people that you love. Find a support system, whether that's online, whether it's in person, whatever works for you. Thank you so much for watching my video. I really hope that you learned something about chemotherapy. if you are going to be going through the process, and I really hope that you are able to find the love for yourself and the kindness toward yourself to do what you need to do that's best for you. Lots of love.